Hello everyone, welcome back to this channel. This is Dr. Farida Rajan Ibrahim Omasundi. So today we are going to discuss hepatitis. So if you haven't liked, please do like, share and subscribe. So what is hepatitis? Hepatitis is a medical condition that is characterized by inflammation of the liver. It can be acute, which is short-term, or chronic, which is long-term. And this has various causes, including viral infections, toxins, alcohol use, autoimmune diseases, and certain medications. The most common and important types of viral hepatitis includes hepatitis A, B, C, D, and E. So before we go into details, let's look at the normal functions of the liver. So as you may be aware, the liver is responsible for detoxifying blood, producing bile for digestion, storing vitamins and minerals, synthesizing proteins and clotting factors, as well as regulating blood sugar and cholesterol levels. So those are just some of the functions of the liver that I thought we needed to highlight before going into details of what hepatitis is. So what are the causes of hepatitis? So there are various causes. Like I mentioned, the viral infections can be one cause. Also alcohol abuse. Alcohol abuse leads to alcoholic hepatitis. There are certain drugs and toxins that can cause hepatitis. For instance, certain medications like acetaminophen overdose and that can damage the liver and lead to hepatitis. We can also have autoimmune hepatitis, where the immune system attacks liver cells. There are also metabolic disorders, conditions like Wilson's disease that can predispose to hepatitis. So what are the types of viral hepatitis? So we are going to look at each in details. We start with hepatitis A. So for hepatitis A, it uses fecal-oral route as a mode of transmission, where there's contaminated food or water. And the incubation period mostly is 2 to 6 weeks. And vaccines for hepatitis A are available. The prognosis is usually good. Most recover completely. So coming to hepatitis B, the mode of transmission is through blood, sexual contact, or mother to child at birth. The incubation for this is 6 weeks to 6 months. So the vaccines are also available, and hepatitis B can lead to complications such as cirrhosis or liver cancer. And the treatment mostly is antiviral medications for chronic cases. For hepatitis C, the transmission is also blood to blood. For instance, during transfusions, IV drug use. The incubation period is 2 weeks to 6 months. And this usually becomes chronic, and there are no vaccines are available. Complications also include cirrhosis and liver cancer. So for treatments, you can have direct acting antivirals. For hepatitis D, the transmission is blood and body fluids. And the vaccines are indirectly through hepatitis B vaccination. For hepatitis E, the transmission is also fecal-oral route, and for vaccines are available in some countries, and the prognosis for hepatitis E is usually self-limiting. So what are the symptoms of hepatitis? So I'll just look at the general symptoms. So we can have acute hepatitis. The symptoms will include, I'll divide it into acute hepatitis and chronic hepatitis. So for acute, we can have symptoms such as fever, fatigue, loss of appetite, nausea and vomiting. So patients will also complain of abdominal pain, usually right upper quadrant pain. They can come in with dark urine and pale stools. And for chronic hepatitis, you can also have things such as fatigue, joint and muscle pain, depression, jaundice, where there is yellowing of the eyes and skin, abdominal discomfort, as well as cirrhosis and liver failure. So what are the diagnostic approach? So for diagnosis, you can do blood tests such as the liver function test, the ALT, AST, bilirubin, where you you do serology for hepatitis viruses. You can also carry out imaging, for instance ultrasound, the CT scan. You can do a liver biopsy to assess damage in chronic hepatitis. So what are the treatment options and management? So for hepatitis A and E, mostly it's just supportive care. It's usually self-resolving. For hepatitis B, like I mentioned, there are antivirals, for instance the tenofovir and entecavir for chronic infections. For hepatitis C, also there are drugs you can use for autoimmune hepatitis. You can use immunosuppressive drugs such as corticosteroids, and mostly it's also basically about lifestyle modifications. If you are smoking, you have to quit, avoid alcohol intake, eat healthy diet, and also monitor your liver health. So prevention, mostly for prevention you have to take a vaccine which is effective for hepatitis A and B, and also practice safe sex. You can also do screening of blood and organs. You should avoid sharing needles or personal items, practice good sanitation and hygiene, and eat well balanced diet, safe food and water consumption. So for various complications of hepatitis, they can include things such as liver cirrhosis, hepatocellular carcinoma, which is liver cancer, liver failure or portal hypertension, and variceal bleeding. So this is just a brief discussion on hepatitis. Follow me in the next video for more content, and if you haven't liked, please do so and share. Thank you.